Over 1/4 of the US population suffers from anxiety or depression. And only a very small percent of that group gets treated. It's even more serious among college students, among the Gen Z crowd and millennials. It's getting worse. As Brian pointed out earlier, I would agree. I mean, I think social media is exacerbating this. Why is it that only a small percentage gets treated today? It is because it is too expensive to get help. Visiting a therapist once a week costs $150, $200, $250. There's too much stigma associated with getting help. You can't afford to leave work or let anybody know what you're going to do. And it's not timely. Oftentimes, you have a crisis. If any of you have ever had folks with depression or anxiety in your families, among your loved ones, you know it's very hard to wait till next Thursday to see somebody. Cognitive behavioral therapy is actually proven statistically in many, many, many studies to be very, very effective. It's the delivery mechanism that just works for too few people who can afford it. I actually speak from experience. I have a wife who is a clinical psychologist. I think the way that this happens is that digital technology now makes it possible to basically interact with therapists on a 24/7 basis. I'm not talking about video conferencing with your therapist. I'm actually talking about a new modality, which is texting with a remote therapist. Many people in this room might say, texting? What? Texting with your therapist? Does that even work? Is that even a thing? It turns out it is a thing. And studies at Duke and Columbia have shown that it is actually more effective for certain populations than actually speaking to the therapist, certainly as effective. And it's available 24/7. It's available at 1/4 of the cost. And it turns out to be broadly and very timely. What's going to happen from there? And so this is already become very prevalent. Consumers are doing this already today. You're going to see this available in your workplaces. It has already now just been rolled out within the last month to all employees at Google. This is going to be rolled out as a benefit because companies want to make sure that their employees have good mental health. Ultimately, there is going to be technology then used to enhance this. For the first time in human history, you're going to have a database of machine-readable, anonymized, but machine-readable data that is going to allow basically machine learning to figure out what works in the therapeutic give and take process. First time ever. This has never been done before. And that's going to allow basically software to instruct the therapists who over time are texting back and forth with their patients as to, why don't you try this? Take this approach. This is going to work better. You're going to start to see AI-assisted therapy in ways that you've never seen before in conjunction with this remote text-based therapy. And I believe this will be a prevalent trend over the next 5 years.